So if you're in the health sciences, you already know that data is absolutely everywhere. But how do you turn all that information into actual life-saving decisions? Well, in this explainer, we're going to show you how biostatistics isn't just some required course, it's probably the most powerful tool in your entire clinical toolkit.
And before we really dive in, I want to give a special thank you to the University of Brahmi and Dr. Abdul Karim Ablasi. The material from their course, NUR 337, was really the foundation for this whole visual guide.
All right, let's start with a little reality check. Every single day of your career, you're going to be looking at a flood of data. Lab results, patient charts, vital signs, new research. It's a lot. So the real question isn't if you'll face this data. It's how are you going to make sense of it all without getting totally swept away?
And that right there, that's the heart of it. See, your job isn't just about collecting information. It's about interpreting it, finding the pattern in all that noise, and then making a critical, life-affecting decision based on what you find. I mean, that's a huge responsibility, and that's exactly where our journey begins today.
So how in the world do you navigate that data deluge without getting overwhelmed? Well, you need a framework, right? A guide that can turn that chaos of numbers into crystal clear insights. And that guide is biostatistics.
Let's break that down, because it sounds complicated, but it's not. Biostatistics is just the science of statistics, but it's tailored specifically for people like you, people in medicine, public health, and nursing. Think of it as a specialized toolkit, one designed to answer questions about health, whether you're looking at one patient's progress or a vaccine for an entire country.
Now, what's really cool about this slide is the flow that it shows you. It's a clear, logical pathway. You start with raw, sometimes super confusing data. Then you apply statistical methods. That's the how. This process transforms those messy numbers into understandable information, suddenly revealing patterns you just couldn't see before. And all of that leads directly to the why we do this in the first place, making smarter, evidence-based clinical decisions that actually improve patient outcomes.
But of course, you can't analyze anything without the raw materials. So where does all this data actually come from? Let's take a look.
And here's something you absolutely cannot forget. The quality of your decisions is 100% dependent on the quality of your data. It's kind of like cooking, you know? The best chef in the world can't make an amazing meal with bad ingredients. Your data is that raw ingredient for every single clinical discovery.
And this data basically comes in two main flavors. Over on the left, you've got primary data. This is info you collect yourself for your specific study. It's the raw, original stuff. Then on the right, you have secondary data. This is information that somebody else has already collected, maybe from census data or a published journal. It's way easier to get, but it's already been processed a bit.
Okay, so once you have your data, doesn't matter if it's primary or secondary, you've got two main toolkits for working with it. You can either describe exactly what you have in front of you, or you can use what you have to make an educated guess about a much, much larger group.
And this slide is the perfect example of that difference. The table on the left, that's descriptive statistics. It's just summarizing the test scores for the 100 students it has data for. No guesses, just the facts. The charts on the right, though, that represents inferential statistics, using that sample data to infer or predict trends about a bigger population of students.
So, think of descriptive statistics like it's your magnifying glass. It helps you zoom right in and see the specific details of the data you've got. The average, the range, the most common results. It just describes the world as you see it.
Now, inferential statistics, that's your telescope. It uses the data from your small, manageable sample to look way out and make generalizations about the entire population. It's what helps you see the bigger picture, to predict trends and test theories. All right, to use either of these toolkits well, you've got to understand the language. And statistics has its own kind of shorthand. It uses a lot of symbols. So let's quickly decode some of the most common ones you're going to see in clinical research.
First up, we've got this guy, X bar. This just means the average of the specific sample you're looking at right now. So for example, it could be the average blood sugar reading for the 15 patients on your ward this morning. It's just the mean of your collected data.
Next is this symbol, mu, which we say like mu. Now, this represents the theoretical average for the entire population you care about. So while X bar was the average for your 15 patients, mu would be the average blood sugar for all diabetic patients in, say, Oman. You usually have to estimate mu based on your sample's X bar.
Okay, this one is sigma, and it stands for standard deviation. This is a really crucial one. It tells you how much variation or spread there is in your data. Are all your patients' blood pressures clustered tightly around the average, or are they all over the map? A low sigma means your results are consistent. A high sigma means there's a ton of variation. And finally, we have an easy but really important distinction. A lowercase n just means the number of people in your sample, your little study group. A capital N means the size of the total population you're studying. Simple, right? But it's essential for understanding any research paper.
Okay, so we've covered the data, the toolkits, and the language. But let's get to the most important part. Why does any of this actually matter to you when you're on a busy hospital floor? Well, the answer is simple. This knowledge directly translates into better, safer patient care.
I mean, this isn't just theory for an exam. Biostatistics is the hidden engine driving modern medicine. It's how we prove a new drug actually works. It's how we decide which treatment is more effective. It's how we know a new vaccine is safe. Heck, even the normal blood pressure range you see on a patient's chart, that was determined using these exact methods.
So, here's the bottom line. Biostatistics isn't just another class you have to pass. It's a lens that lets you critically evaluate research, understand trends in your patients, and contribute to evidence-based practice. It literally empowers you to turn everyday data into life-saving discoveries. So the only real question left is, what will you unlock with it?